Simulation has been used in nursing education for many years and has been shown to be beneficial to the undergraduate nursing student. We've begun to use simulation in graduate programs also. In our Doctorate of Nursing Practice program, we began to look at what were some areas where students needed to have simulation. What were areas that the students felt that they weren't prepared as they entered the clinical area, or what were areas where our preceptors said to us, your students need a little bit more help with this before they walk into our clinics. One of those areas was with the pelvic examination of our female patients. We looked at multiple systems and decided to use the Pelvic Mentor. We chose the system because the Pelvic Mentor feels real. The skin feels real to the students as they're assessing that patient. It also gives the student instant feedback. So they can know instantly if they touched what they were supposed to touch or if they totally missed it. It also frees up our faculty. We can put a test in there, set it up ahead of time, the students will sign on, and it tells us if the student completed the assignment and how well they did with it. We begin to use the system in their physical assessment course, so it's a requirement for them to come here. We bring standardized patients in for them to do a head-to-toe assessment, but what we have found a difficult area is for our female patients being willing to have pelvic examinations done. And because of this, the Pelvic Mentor has been able for us to support the education of that student so that they're more prepared to go into that clinical arena. As they move through the program and they go into their primary cares, our simulation center is always open for those students to come in. So as they learn abnormalities in the female assessments, they can come in and we can use other uterus, different ovaries, so those students can get the abnormal assessments also. The Pelvic Mentor prepares our students to go into the clinical area. This is going to improve patient satisfaction because our students will be better able to do those examinations, and it will also help our students to be more confident as they enter into that arena.